So are the staff members who are contracting the virus, are those nurses or are those your other employees?
Most of them have been, again, you know, I talked about 80 of them that are out on quarantine right now, and the vast majority of them are RNs, LVNs, and CNAs. Um, we don't, and if I understand the question correctly, we certainly don't put COVID positive patients or staff in with COVID positive patients. There was some discussion early on in this pandemic that if our entire workforce, you know, became infected, what would we do? And we literally talked about, well, you would create dedicated COVID patient units and you would staff them with COVID positive employees who just had mild symptoms. So they could still work, but they were COVID positive. I mean, that was kind of the thinking. So we've never got to that. So if we have a COVID positive employee, we send them home and quarantine them until they're no longer positive, and then they come back to work. So we don't have COVID positive employees taking care of COVID positive patients. But our our employees have contracted COVID taking care of COVID positive patients. Sometimes it's when we know that that patient is positive and for whatever reason the virus still passed. Oftentimes though, when they contracted in the hospital, it's because somebody doesn't appear to be COVID positive. In fact, they've tested COVID negative. Early on, we had a patient that we tested, or actually it was an employee that we tested over and over and continuously came back negative, but they weren't feeling good. And so we did a bronchoscopy and found the virus deep in their lungs. And that's when they showed positive. So we have patients that are like that, that we test them and they're negative, and yet they have the virus and they're contagious. And so probably the majority of our employees that have contracted it in the hospital did it with a patient that we didn't know was COVID. Right. But then we also, many of our employees have contracted it outside the hospital, the same way the general community has contracted it.
Yeah.